You also want to get away any brittle tissue that isn't going to stay well.
Nothing that is not attached.
Yeah, you want to adhere to a nice solid foundation.
So the whole system is very simple.
Yeah.
All right, so what I did is just I prepped the nail bed, and tomorrow we'll go more into depth, but it's only 3 steps. We're going to use the bonding agent first. It's called Bond. So we apply very, very little amount on the nail surface to create the optimal adhesion and bonding. Normally you will have your patient in a very comfortable position, so because we need to work with the toes completely flat. So
this comes in different colors?
It comes in basically 2 colors. This is the opaque, which is the one that you will use the most. So we start the application on the proximal, on the distal portion of the nail, because in this case it's restoration. So we wanted to build the free edge of the nail first. We follow the natural folds of the nail, and this is a process that we call flash curing, which only takes like 10 to 15 seconds. The resin is not going to move, and then it's a gel. It's a dental resin, actually. It has a gel consistency, but it's a dental resin. It's very flexible. So now I'm going to anchor it to the natural nail.
She's still working with the resin. So she started at the distal end and flash cured it, so she exposes it for about 15 seconds.
So the free edge is basically the vein of the skin, right?
Yes. So that's why you start from the distal portion of the nail first to build up and create the free edge.
Right.
And then what I'm doing at this point is that I am anchoring the resin to the natural nail. It's a very fast procedure. Doesn't take too long. We need to make sure is that we don't touch any part of the skin on the proximal or lateral folds of the nail. And now we can cure for the full 2 minutes. All right, so at this point, we have layer, that sticky layer. We call that dispersion film. So we remove that with an alcohol pad. We have to work dry. We're not supposed to use alcohol or anything. We don't want to trap moisture in between the resin and the natural nail. And then at this point, you can feel that the nail is nice, it's smooth, it's totally dry. So if needed, we can...
Now we could send Tom home like this.
Right now, yes.
That nail's ready to go. He can put his socks and shoes on
yes.
and walk out.
And if you look from this distal view, you see that the toenail is thin, right. So it's balanced. But let's pretend that we have bumps. So because that's what happens when we normally do, we have a little bump. Remember, this is a cosmetic procedure, especially for the female patients. When they apply nail polish, you could see every little, So we want to make sure that everything's nice and smooth, especially for them. So now I'm going to apply the seal. And why I'm applying the seal? Because I broke the sealer from the resin when I was filing and shaping and making sure that the nail was nice and even. So now I'm sealing. Now, I know that some of the male patients are like concerned about the toenails being so shiny and whatnot. It will wear off after maybe a week or so. It's gonna be less shiny. So now I'm curing this for 2 minutes, but after, seriously, when you stand up, because sometimes when they're at your table, they see that it's way too pink, and then they're like, whoa, no, it's too pink, I don't want that. But then you stand up, the blood flow goes normal, it looks nice and a little shiny, but then after like, I don't know, maybe a week, wear and tear, and then it doesn't shine as much. Now, if you stand up, you're going to have a nice looking, fresh, beautiful toenail.
I wanted to see the before and the after right next to each other.